Back to Studio 10, everybody. It's time for On Your Health, our On Your Health segment where we discuss important medical and health topics with the doctors at Florida Medical Clinic. It's the Bay Area's first clinic to merge both primary care physicians and specialists all under one roof.
And today we welcome Dr. Ira Guttentag, an orthopedic surgeon and medical director of the Tampa Bay Lightning, to explain why knee replacement surgery isn't as scary a proposition as it used to be. Welcome to Studio 10.
Yeah, great to be here.
So what is it, your involvement with the Lightning? Well, you must go through a lot of tape, you know?
It's a ton of tape, and it's been a lot of fun. The guys are great. They're very motivated to get back from injuries, so they're actually some of the easiest patients to deal with because they're very motivated to get back and they follow directions very closely.
But the human body wasn't really designed to play hockey at all, was it?
It's amazing the amount of stress they put on their bodies on a day-to-day basis, particularly during the playoff time. The intensity is so high, and what they actually play with, the amount of injuries that they play through, it's truly incredible.
Now, what are the typical duties of an orthopedic surgeon? What all falls under your supervision, if you will?
Well, half my time is spent taking care of athletes of all ages, from the weekend warrior to the professional athlete. And most of those injuries include shoulder problems and knee problems, torn ligaments, torn tendons, torn cartilage is probably the top three things that I take care of. And what's great about today's day and age is that a lot of these things are taken care of through minimally invasive procedures, arthroscopic procedures. And that allows for a much quicker recovery. My other half of my practice deals with the older population, people that have arthritis, the wear and tear type of, the baby boomers coming back. They're very athletic, and they do a lot of things, and they wear out their joints. So I do a lot of knee replacements, partial knee replacements. And again, the technology is really progressive so that the surgery is not as big a deal as it used to be.
And you were talking about the recovery time is a lot less. I mean, it can be 9 months or even more for some people, can't it? What is it like with this new technology?
Well, in the back in the day, about 10, 15 years ago, it would take 4 to 6 months to recover from knee replacement. Today, we have what we call a rapid recovery knee replacement, and by 4 to 6 weeks, people are back to pretty much their normal day-to-day activities. And the program is divided into 3 separate sections. One is the preoperative, or before surgery. We have the patient go through an extensive educational program at the hospital so they know exactly what is going to be going on beforehand. And the nice thing about it is we're able to set the goals really high, and they know what the expectations are, so that the morning of the surgery or the morning after the surgery, when someone says it's time to get out of bed and walk, they're not taken back and say, what are you talking about? And then the second part is what I do intraoperatively. With the new technology, we can make very small incisions and avoid cutting through muscle. And by that technology, they're able to move their leg the next day and be able to lift it and walk. And then the third part, which is probably the most important, it's most frightful for the patient, is that they're scared about how much pain they are going to have afterwards. So what we do is we give them a cocktail of medication, and alone each medication really doesn't have a lot of potency, but in combination it works together. So we cut out the narcotics so that they're not tired or nauseous after surgery, or they lose focus, and instead they wake up, they're clear-headed, they don't have pain, and they can get out of bed.
Now, you mentioned, doctor, that you deal with a lot of the baby boomer generation who maybe they have been very, very active. I know my father falls into that category, definitely has had a lot of work on his knees to this point. But there's also an instance of where people are maybe too out of shape for their structure to be supporting them, right?
Well, the problem of obesity is very large in the United States, and it's just a matter of physics. And if you have a very large frame on a small chassis, so to speak, then you're going to get wear and tear, and it's going to happen prematurely. I mean, the key really is for people to exercise and keep moving, because that's the best thing to do to preserve their joints.
And that again is an injury of attrition. Is that what that's called?
Well, I mean, sports medicine, we talk about shoulder injuries, but a lot of my patients are 60-year-old carpenters that have been doing a lot of work for years and years, and manual laborers that are digging holes and things like that. So that wear and tear over time can cause the tendons to get thin and eventually pop, and they have to be surgically reattached.
Doctor, because I have you here, I have to ask you, is it really a bad idea to be a runner? Are there other activities that we should be doing in place of that?
Well, I'm a runner, and, you know, I think
that's all I need to know.
Yeah, but you can do your own surgery if you wanted to, for crying out loud.
But, you know, I think that running is great, but as you get older, you may want to cross-train a little bit and mix it up with swimming and some lower impact activities.
Okay, and obviously taking care of the lightning, he knows his stuff. But, let's talk a little bit about, first of all, you're on the board of directors with Florida Medical Clinic. Talk a little bit about the interaction that you have there between all the different physicians and how important that is for the overall patient care.
Well, it's really a terrific setup that we have. We have the benefit of having multi-specialty doctors at our fingertips, literally, because if I have a patient that comes in and they need knee surgery, and I want to know whether or not they have an allergy to something, they have a bad heart, or they've had a history of infection, which is, you know, an important thing to know before going into surgery, I can simply press into the computer who they've seen, what has been done to them. And at my fingertips, we have 130 doctors that I can communicate with. In the old days, we had to call someone, get a fax, find paperwork.
Could take forever.
Can take forever. This is 3 seconds. I can tell you everything that patient has had for the last 10 years.
That's pretty incredible.
We are completely out of time, but thank you for being here, Doctor. If you'd like to learn more about the latest advances in patient care and medical research, by all means visit Florida Medical Clinic online at floridamedicalclinic.com. While you're there, you can locate the office nearest you, learn about their doctors, and even request an appointment, and maybe meet one of the Tampa Bay Lightning that might be in there.
Who knows?
You never know.
Doctor, thank you so much. All right, feel like your budget is getting in the way of looking your best? When we come back, beauty expert Jen Fowlick shows us some new trendy makeup products that fit anybody's budget. Stay tuned.
This segment was sponsored by Florida Medical Clinic.